We all know how hard it is to stay on top of everything. It's a lot. So today we're diving into something super important. Public health innovation, specifically around stuff like HIV and STIs.
Yeah, it's definitely a hot topic right now, especially with all the changes we've seen in the past few years.
Right. And the document we have today is actually about a new platform aiming to change how we approach these issues. And, well, that's what we're here to break down for you.
Exactly. Get to the meat of it.
Get to the meat of it, yeah. So let's just jump right in. I mean, we all know HIV and sexual health are, well, they're really big challenges in the U.S.
They are. And they're not going away.
No, not at all. And the document actually mentions a pretty startling stat. Over 40% of adults avoid getting tested for HIV or STIs.
And that's just because of stigma and privacy concerns.
Just because they're, worried about what people might think or if their information will stay private.
And that's a problem because it means people aren't getting diagnosed or treated as early as they should be.
Totally. And to make matters even more complicated, we're looking at a potential shortage of healthcare workers on top of that.
You're right. Almost half of the infectious disease specialists are about to retire.
And when you think about how many case managers and DIS workers we have, it's, well, around 58,000 nationwide. That's not a lot.
It's not, especially considering STI rates have actually gone up 7%.
Wow, 7%.
It's making it even harder to reach those goals of ending the HIV epidemic. And all of this is putting a huge strain on our public health care systems, both in terms of money and just being able to run smoothly.
Right. And it just seems like we need some fresh solutions. Thankfully, that's where this platform comes in.
That's right. This platform, called Versante, is all about a 360-degree approach from prevention to prevalence. They call it a prevention to prevalence platform.
I like that. So what makes it so different? What's the secret sauce?
Well, it's built around 3 core functions: outreach, screening, and management. They actually call it OSM.
OSM. So it's not just about one thing. It's about the whole journey.
Exactly. It's about defragmenting the care pathways.
Defragmenting. So like making it less scattered.
Yeah, think of it like this. It connects people directly with the people who can help them most. Disease intervention specialists, those are the frontline folks, and case managers, so they get consistent support.
They don't fall through the cracks.
Exactly. No one gets lost in the system. And it's also about recognizing how different health issues can be connected.
They actually use the term Syndemics, right? What's that all about?
Yeah, it's a fancy way of saying that multiple health conditions can happen together and make each other worse.
Oh, okay. So like someone could have HIV and also be dealing with something like diabetes.
Exactly. And then they might also have mental health challenges on top of that. It's all connected. And this platform is set up to address HIV, MPOX, STIs, but also things like diabetes, hypertension, oral health, and mental health. It's pretty comprehensive.
Wow. I mean, getting people to engage with these kinds of topics can be tough, though.
It can. There's a lot of stigma.
Yeah. So how does this platform try to overcome that?
Well, they're focusing on early intervention and making the whole experience as anonymous as possible. They even call it gamified engagement.
Gamified, like a game.
Kind of. The idea is to make it less intimidating, less clinical. They want people to feel comfortable seeking information and support without worrying about being judged.
Makes sense. It's all about taking that first step.
Yeah.
So what are some of the key features? I know they highlight talk, test, treat, and trace.
Right. Yeah. 4 main components.
Starting with talk. What's that all about?
Talk is all about creating a safe space, like a judgment-free zone, where people can talk about sensitive stuff without fear, HIV, sexual health, substance use, mental health, whatever's on their mind.
So it's about giving people the information they need and answering those tough questions.
Syndemics. That first point of contact. Then you've got test, which goes beyond the standard screenings.
Beyond the standard screenings, what do you mean?
Well, they offer these things called syndemic screenings, so they're checking for multiple conditions all at once.
Ooh, that's really smart. Catching things early.
Exactly. Plus, they've got these chance scores that tell you how likely you are to have a certain condition. They also offer access to at-home test kits and can even connect you with specialized testing services if needed. It's very personalized.
It's like a one-stop shop for all your testing needs.
Yeah.
And then there's treat. So this is where people go after they've been tested, right?
Yeah. Treat is all about seamless care coordination. So they've got telehealth options, which is super convenient, peer support networks for that extra layer of support and connections to healthcare providers.
Makes sense. And I know a lot of people struggle with figuring out what kind of care they can even get
Right. That's why Treat also helps people navigate eligibility requirements for different programs. No one should have to jump through hoops to get the care they need.
Like that. And finally, we have Trace.
Yes, Trace is more focused on the bigger picture, public health. They use AI to track health trends and give public health officials a better understanding of what's happening out there.
So it's about staying ahead of potential outbreaks and responding quickly.
Exactly, being proactive. They even have a disfocused, insightful digital twin, which basically helps disease intervention specialists do their jobs better with digital tools.
Oh, wow. So using technology to streamline their work.
Right. And for the general public, they have a public-focused Syndemic AI agent. It's an AI that can answer questions and give people information about those interconnected health issues we talked about. It's pretty cool.
AI seems to be a big part of this whole platform.
It is. They're using AI that can understand huge amounts of health information, identify patterns, and even analyze images to help with diagnosis. They've also got AI-powered speech recognition, multilingual support, and, of course, ethical safeguards for the AI systems.
They're really going all in on the tech, and it sounds like they've really thought about how to use it responsibly, which is important.
It is, and their goal is to make sure that all these AI tools and their syndemic models are in line with the CDC's goals.
So it's really all about creating this more connected and accessible public health system that's specifically designed for communicable diseases.
Exactly. They want to break down stigma, support healthcare workers, and integrate all the different parts of care.
It's really ambitious, but it also seems really promising, using technology to make real change in the world.
I agree. It's exciting to think about the possibilities.
And it really makes you wonder, with these kinds of platforms, these personalized anonymous spaces powered by AI, how will people engage with public health in the future? What kind of impact can we have on our communities?
Yeah, how will these tools change things? It's a big question.
It is. It definitely is. And, maybe that's something for all of us to think about. Thanks for joining me today.
You're welcome. It was great to be here.
It was great to have you. All right, that's all the time we have for today's deep dive. Until next time, stay curious.